Congress are about to force through a vote tonight, Sunday night, that will devastate millions of American families, rip hospitals out of rural communities, and potentially leave hundreds of thousands of senior citizens without a way to pay for nursing home care, leaving many of them homeless as a result. And if it sounds odd to you that they're doing this tonight, Sunday night, rather than wait to hold a vote tomorrow morning, that's because it is odd, but it's also intentional. They're doing it this way, holding votes on a weekend night long after many Americans have turned off the news and put their kids to bed, because they know just how genuinely evil what they're doing is. And more than that, they know who this vote is going to hurt most. And it isn't immigrants. It isn't liberal cat ladies or spooky trans folks or latte drinking soy boys. It's rural Americans, particularly those in red states. In other words, it's Republicans' own voters. Most of the headlines about this vote have focused on the big picture, which is admittedly terrible. 1 in 5 Americans rely on Medicaid, including 40% of all kids. And under the current GOP proposal they're expected to vote on tonight, 7.6 million people would lose their health insurance in the next 10 years. But what most of the stories didn't mention is that this hit will be felt hardest in rural communities. Rural Americans are several times more likely to have jobs that don't offer health coverage and are significantly more likely to rely on Medicaid to access health care than their non-rural counterparts. Nearly half of rural children are only able to access any health care because of Medicaid and CHIP. And perhaps most devastatingly, tonight's vote risks permanently closing the doors of hundreds of rural hospitals, leaving millions of Americans without a healthcare facility anywhere near them. No emergency room, no labor and delivery ward, and no cancer treatment center. Just hours of endless road between you and life-saving care. In my home state of Oklahoma, 1 in 3 rural hospitals are at immediate risk of closure. 1 in 3. Even the rural hospitals that manage to stay open will face massive financial cuts because of tonight's vote. And hundreds of them will be forced to close entire units and stop offering certain types of care entirely, making an already dire healthcare crisis in rural America even worse. In the last decade or so, a quarter of rural hospitals have already stopped providing obstetric care, forcing pregnant women to drive hours to seek care and deliver their babies, putting the lives of both the women and their children in danger as a result. And tomorrow morning, Republican leaders will claim that they didn't make cuts to healthcare. They just went after fraud, waste, and abuse. They will throw around terms like work requirements and hope that that convinces their voters that nothing they've done targets them. They will be lying when they do that. We already know what happens when you tie Medicaid to cruel work requirements. Georgia tried it. They launched a program called Pathways to Coverage that only gave Medicaid to people who could jump through ridiculous bureaucratic hoops to prove that they were working or in school. It was such a disaster that only 6,500 people enrolled, 75% fewer than the state projected, and over $86 million was wasted, most of it going to consultants and administrative overhead. Not care, not people, consultants. Even the man that Republicans used as the face of the program, a full-time mechanic from rural Georgia named Luke Seaborn, lost his own coverage twice in 1 year because of how broken the system was and how impossible it was for working folks, particularly those in rural parts of the state, to navigate. This is cruelty by design because Republicans know that these work requirements don't help people. They just make it harder for poor folks, especially older rural workers, disabled people, and caregivers to keep the healthcare that they already qualify for. So while Republicans are giving floor speeches about saving taxpayer money, the reality is they are cutting care to rural families, closing rural hospitals, and slashing support for rural seniors, parents, and children, all while handing out tax breaks to billionaires and defense contractors. This budget reconciliation isn't just bad policy. It is a targeted assault on the working poor, especially the working poor in the rural South and Midwest. If Republicans get their way tonight, the only thing left in some small towns will be a shuttered hospital and a Dollar General. So if you're watching this and you care about your community, whether you're in rural Kentucky, upstate New York, or western Oklahoma, now is the time to speak up. Their offices may be closed right now, but you can still leave a voicemail. Call your member of Congress right now. Leave a message demanding they reject these cuts and get loud on social media immediately. Share this video. I've posted it on every single platform imaginable, which you can find in my bio, and do all of the things like, comment, everything, because healthcare is a human right, no matter your zip code.